Hello, everyone. My name is Zohir Chaudhry, and this is another set of slides on the Global Health and Culture series. We'll discuss about rituals and cultural practices with impact on health. So people around the world have beliefs and behaviors related to health and illness that stem from cultural forces as well as individual experiences and perception. As we go in different countries around the globe, we will notice that for health and well-being, people not only rely on Western biomedical system, but also more traditional and alternative healing systems. Due to positive experiences with alternative healing system and shortcomings in the Western biomedical systems, people have relied on both of these systems over time. So here we'll actually discuss initially some of this traditional medicine strategy, and then slowly talk about the various rituals and behaviors that impact health in different parts of the globe. So about 33.2% of adults in the United States use non-biomedical treatments such as acupuncture, herbal preparation, medication, and as well as spiritual healing. The global importance of these approaches is evidenced by WHO Traditional Medicine Strategy for 2023, and as well as WHO established 21 regional centers for the study of traditional medicine to strengthen the evidence base and promote quality. In the past few decades, we have moved from rejecting traditional health beliefs and practices to understanding that culturally rooted traditional healing approaches are valued and used, often in combination with biomedicine. At this time, there's increasing recognition that such approaches can and should be rigorously evaluated. So this table to the right lists types of healers encountered during a typical global health work in different places around the globe. In the table, you can see healers ranging from indigenous practitioners to Western biomedical providers, pluralistic healers, as well as other medical systems. So pluralistic healers are those who mix the two traditions between the indigenous and the Western biomedical system. And although some Western biomedical healers and those from other medical system may also mix traditions in their practice as well. The types of healers are found in different combinations in different cultures. Even middle and upper class individuals who can afford Western biomedical care may use other types of practices and practitioners when seeking to get well. Pluralistic healers, as we mentioned, combined both the indigenous and the Western biomedical practices. And one example would be like injectionist, who will give an injection of antibiotics, vitamins, or other drugs purchased at pharmacies or stores. And in today's environment, in many developing countries, this practice increases the risk of contracting HIV or hepatitis, especially if the syringes or the needles are not sterile or are not properly utilized. Traditional chemists and herbalists, as well as storekeepers and vendors, often sell Western biomedical medications, including those that require a prescription in the United States and in Western Europe. In many developing countries, people can pick up medication from local pharmacies or stores without a prescription. And again, in many other countries, pharmacies are sometimes the most important source of diagnosis and treatment as well. Until recently, Western biomedical practitioners totally rejected indigenous system, as I mentioned earlier, often failing to recognize how many practices and medicines that Western biomedicines has borrowed from other systems. For example, quinine, digitalis, many anesthetics, aspirin, and estrogen, they're all borrowed element from other non-Western biomedical practices of healing. Elements of this indigenous system that were derived in the past, such as acupuncture, have now found also ways into the Western medical practices and are being legitimized by Western research as well. In here, we can see different types of healers around the globe, and with your reading, we probably also have additional information. And here we can see rituals or practices that have impact on you on health. Typically, rituals do vary from culture to culture or establish procedures. And rituals both reflects and transmit a culture's norms and other elements from one generation to the next. For example, graduation ceremonies in colleges and universities are familiar examples of time-honored rituals in Western countries. In many societies, rituals help signify one's gender identity. For example, girls around the world undergo various types of initiation ceremonies to mark the transition to adulthood. And there are quite a lot of examples in Zambia and other African countries where a month-long initiation ceremony are done, where girls learn song, dances, secret terms that only women know. In some other cultures, special ceremonies also mark a girl's first menstruation period. Such ceremonies are largely absent in the United States, where a girl's first period is a private matter. But in other cultures, the first period is a cause for celebration involving gifts, music, and food. So these are especially some rituals that are practiced around the world. On the other hand, in here, I'm showing some rituals that may actually have some adverse health impact. For example, in some Western world, the alcohol consumption that is seen may actually be very damaging to health. And in other societies, especially Islamic society, there's a countrywide societal ban on consuming alcohol, selling alcohol. So it's very difficult to be able to do that. Then we talked about female genital mutilation practices in Africa and in Asia in some previous slides, which are also very health damaging, even though it's a ritual that is practiced in some of those countries. Food binding in China is another ritual because in China it is like thought that women with small feet are prettier. So in order to keep the feet small, you want to keep the feet bound to tight shoes that will keep your feet from growing that big and also the bone structure from growing that big. Male circumcision may also be a specific ritual or cultural practice that is practiced in Islamic and Jewish society that may actually have some positive health benefit because it is shown that circumcised male will tend to have less sexually transmitted diseases because of their circumcision, because bacteria and pathogens don't get accumulated because there's because of the absence of the foreskin. While you think about this, think about other examples that have both positive and negative health benefits, rituals and cultural practices around the globe that may have both. In here, I'm showing in the Western world, especially in the 1950s and 60s, how widely accepted was smoking. and the struggle of public health campaigns to override the positive effect that was created from advertisement and movies and so forth, that smoking is sexy or smoking is macho and so forth. So it took a lot of time to like decouple that part and really convince the adverse effect of smoking to human health. So finally, culture influences behaviors that have important health consequences, such as the ones that we mentioned. Culture should not be over-interpreted at the expense of socioeconomic factors. They both play a role to health, essentially. In many traditional societies, the overall theme of life is not to challenge nature, but to harmonize with it. And in some society, wealth is a social disorder when power is misused. And also, it is important to know that cultural trends are not static. People are constantly changing, and with that, some of the culture slowly also changes over time. Okay, so with that message, I'd like to conclude this set of lecture about cultural rituals and practices that have both adverse health consequences as well as positive health consequences to human health as like in the context of global health. Thanks.